video is a refresher for Ella's school staff for the next school year how to do a G-tube feeding. We do blended diets. We do it a little bit different than most people. Usually there's an extension tube that comes in here, and it's a tube that you put liquid in through one of these syringes, and it just goes down and flows into her belly. She got sick on those and threw up a lot, so we started doing a blended diet. So that means I blend all her food at home, try to make it healthy, add lots of fat so she can gain some weight. But whenever we're out and about, that's not very convenient. So I found these syringes at the Squirrel store. They are a lure lock tip that fits into the Mickey button, like that. So you have your catheter tip syringe that you use with all the G-tubes, and you put the lure lock tip on that, and it goes in there. So that's the start of how we feed her. So we have our fast food. Any kind of baby food works for us. Take the tip off of this, and our cool trick is to just put this right in the tip of the food and shove it on in there. Get this filled up with no air. Put the tip on it. You put it right in here into her G-tube, and then you push it in. Usually you go a little slower than this, but we've been doing this for a long time, and she's used to the faster speed. So you put that in, and you try get the rest of it. Kind of squeeze it up to the top. There. There's two methods. You can pull this down, or you can just squeeze this into it. Whichever way works better for you. Then you can see I have a little bit of air. Whoops, lost that one. I have a little bit of air on the top of that. So then I try to kind of shove that back up in there, because if it's just a little bit like that, it probably wouldn't hurt anything. We probably eat more air and our normal eating than she does with this, but it's nice to get that out. And then you just put the tip right in there. You can kind of feel it go in. If you don't have it in enough, then it flies back at you. And sometimes she will tighten her belly really tight, and then you're like, oh, what's not going in? Just kind of let her relax, or tell her to relax, and then go in. Sometimes I think she's playing a game with us. But you do that for as many bags as we've told you to give her, and that's it. Finish with water. Always finish with 2 syringes of water.